Right now, influenza is widespread here in the Commonwealth. In this week's Martha Jefferson Healthwise report, we look at the symptoms and what you can do to help prevent the spread of flu for the remainder of the season, which goes until late March.
If you have a normal course of the flu, it's going to cause high fever, sore throat, cough, muscle aches, and joint aches. And that'll usually last about 2 or 3 days. Then you'll feel kind of wiped out for several days after that before you get back to normal. But if you have a complicated case of the flu, it can set you up for pneumonia, which is actually a bacterial infection.
It has been a busy flu season already at Martha Jefferson Hospital, with the lion's share of positive cases being treated in the last 2 weeks. Out of 534 flu tests, 34% of those folks have tested positive for the infection.
We do worry when we see an uptick early in the season because we don't know whether or not it's going to keep increasing or whether we're just having an early peak and it'll come down early as well.
Only time will tell, but with influenza season typically lasting until late March, there are plenty of things you can do to help keep yourself and others out of the grips of the potentially deadly illness. And it starts, Dr. Carrie Hall says, with getting the vaccination.
The vaccine is quite effective. Even in this year, when it's not quite as good of a match as it is usually, it's still expected to be very effective at preventing cases. Secondly, if you're around people who are sick, it's important to wash your hands very frequently and try to avoid touching your face because that's how the virus enters your body. And then if you are sick, it's very important to stay home. Stay home from school, stay home from work, because that's going to prevent spread.
Another layer of protection the hospital is adding, asking visitors to wear a mask when entering the facility.
In general, it's helpful if visitors wear a mask when they come into the hospital when flu is as widespread as it is right now.
And it's not too late to get a flu vaccination. Just check with your primary care doctor or retail pharmacies around your area.